Hello, my name is Andrea Vascones. Today I'm going to talk about gingivitis complication. Definition: Gingivitis is an inflammatory condition of the gingival tissue, most commonly caused by bacterial infection. Unlike periodontitis, there is no attachment loss and therefore no migration of the junctional epithelium. The condition is restricted to the soft tissue area of the gingival epithelium and connective tissue. Among all the periodontal diseases, gingivitis is considered to be the commonest. There are various forms of gingivitis based on clinical appearance, duration of infection, severity, and etiology. However, the chronic form of the gingivitis that is caused by plaque is considered to be the most frequent variant. Clinically, the gingival tissue are characterized by swelling, redness, tenderness, a shiny surface, and bleeding upon gentle probing. The most common complication or sequelae of chronic gingivitis is the progression of the inflammation towards the underlying tissue and bone, resulting in periodontitis.
Gingivitis is the Latin term for an acute or chronic inflammation of the gums. Healthy
Healthy
gums,
gums,
as
as
pictured
pictured
here,
here,
are pale pink, tightly attached to the teeth, and, when looked at closely, have a certain pattern, similar to an orange. By contrast, inflamed gums almost always lose this pattern, swell up, bleed easily, and turn dark red, as seen in this movie. In most cases, gingivitis does not cause pain. In a general sense, all bacteria found in the mouth flora can cause gingivitis. Another possible cause is Escherichia coli. Non-treated gingivitis can turn into periodontitis. You can find out more about that in the video by the same name. Overall, the most common cause of inflammation of the gums is plaque. There's more about this topic in the video Plaque. Subsequently, it's very important to remove plaque thoroughly from the teeth surface. However, you will not be able to do this if you have overhanging fillings, leaking fillings, overhanging bridge or crown edges, or if you have interlacing teeth caused by crowded teeth, for example. In order to prevent any further gum inflammation, the dentist has to work thoroughly and carefully and clean the teeth well. If your gums still become inflamed, they can bleed quite heavily for a short time. However, this should not be taken as an acceptable excuse. You still have to continue brushing them. Many people with red or inflamed gums stop cleaning their teeth because they're afraid of the blood. However, this causes more plaque and can be the beginning of a vicious cycle. Hence, good mouth hygiene represents both treatment and prophylaxis against plaque-associated gum inflammation, also known as gingivitis.
Application in dentistry. The prime objective of treating gingivitis is to reduce inflammation. This is achieved by the use of different instruments to remove dental plaque deposits. Gingivitis, in its initial stages, can be easily managed if the patient starts following oral hygiene protocol, which includes regular tooth brushings with an appropriate technique and interproximal hygiene, such as dental flossing or the use of interproximal brushes. The removal of plaque and calculus is also professionally achieved by scaling and root planning according to the severity of the condition. Medications in the form of antiseptic mouthwash that contains chlorhexidine can also be prescribed in conjunction with the mechanical removal of plaque. Pros and cons. Pros. There are no pros to gingivitis because it's an oral disease. Cons. If you develop gingivitis and do not have the plaque or tartar, hardened plaque, removed from your teeth, the condition may get worse and lead to peritonitis, recurrent gum abscesses, painful collections of pus, increasing damage to the periodontal ligament, the tissue that connects the tooth to the socket, increasing damage to and loss of the alveolar bone, the bone in the jaw that contains the sockets of the teeth, receding gums, loose teeth, and loss of teeth.
Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and today I want to talk a little bit about a extremely common problem. In fact, 70% or more of our population has it, and that's gingivitis. Gingivitis means inflammation of the gingiva or the gum tissue. There are two kinds of gingivitis. There's plaque-induced gingivitis and non-plaque-induced gingivitis. Plaque-induced gingivitis is usually caused by lack of adequate oral hygiene or home care. Non-plaque-induced gingivitis can be a number of other factors. It can be viral, it can be systemic, it can be due to local exposure to other factors, chemicals, but the most common is the plaque-induced gingivitis, and that is the one that typically can lead to what's called periodontitis. And periodontitis means that it's involving the area more beyond just the gum tissue, but the surrounding supporting tissue of the tooth, the bone to be specific. Now, periodontitis tends to be more severe. You start losing bone, you lose the support of the tooth, you lose the tooth. But if we can catch it in the gingivitis stage and eliminate the gingivitis, very often we can stop it at that point and prevent it from getting to the periodontitis or the more serious stage of bone loss and potential tooth loss. In plaque-induced gingivitis, some of the symptoms that we see are redness, bleeding, little tenderness of the gum. Sometimes there is not much in the way at all. So if we have a patient who comes in, we will automatically take a sample of the plaque and the bacteria that are in the plaque and see if there are pathologic or pathogenic bacteria and or parasites in there. And we can catch that and treat it early to prevent periodontitis. If it's very early, just really good home care, good cleaning at your dental office, and good home care on your part, if you're taught properly how to do it, can eliminate the plaque that causes gingivitis and therefore very often eliminate the periodontitis that would follow. As far as home care is concerned, I think it's important to clean between the teeth, either with floss or interdental cleaners, so that you remove that plaque thoroughly between the teeth, because typically that's where gingivitis and periodontitis start. Brushing thoroughly, I'm not sure that the type of toothpaste that you use makes a real difference, but brushing thoroughly makes a big difference. Using a water cleaning device can also be very helpful, because sometimes cleaning between the teeth with floss and brushing doesn't remove everything as completely as it might, but the water cleaning device can stimulate the tissue and remove particles that may be missed otherwise. So really good home care is the key to treating gingivitis, the early stage of gum disease. Thank you for watching. Don't forget to subscribe. If you have any comments or questions, don't forget to leave them below. And remember, take care of yourself. You have a healthy mouth. You're going to have a healthier body. Have a great day.
Restore your smile and your health with the help of Dr. Nemeth and his associates. Visit Dr. Nemeth.
Issue update in Ecuador. Gingivitis occurred in out of 4 of Ecuadorians during their lifetime, but with proper dental care early on. It is easily reversed if left on treatment. Gingivitis can develop into a more severe form of gum disease, not at periodontitis, which is a major cause of tooth loss in adults. Conclusion: gingivitis is caused by several of the agents mentioned above, such as poor oral hygiene, which causes biofilm build-up. Good hygiene should be taught at home as well as at your dentist's office, which you should attend periodically. Gingivitis shows more complications in the anterior area due to different causes such as poor brushing in that area. Thank you.